and then...
Hey, here we go. We'll do it.
Oh, we're going...
It seems as though in the year 2018, the phrase, "we'll do it live," has a life of its own. In any case, I'm excited to be live because it's always the most fascinating way to have a conversation. We are sitting down with a fellow who is the COO of a brand new company here in Utah. They have history, and they are certainly in an industry sector which all of us are interested in, even if we don't really understand a whole lot about what's happening with our health insurance. And hopefully everybody watching is well covered this morning, but certainly my guest is going to tell us about an operation that is going to help many more Americans make the most and maybe even understand their health care. The company is GoHealth, and this is the CEO, Jim Sharman. Good morning, sir. How are you, man?
Good morning. Good morning.
Good to see you.
Thank you for having me.
Yeah, absolutely. Congratulations on being physically in Utah. That's pretty new.
It's a great place to be.
Yeah, right on. Had you spent time here before? Did you guys, as your management team, you've selected Utah as a spot for one of your 3 big operations?
Yeah, correct.
Talk a little bit about that.
So company's been growing. 17 years old, we grow at about 47% a year. So we're kind of a high growth company and have that track record. And as you said, in the health insurance industry, there's just an ever increasing demand for health insurance. So we had 2 other locations in Chicago, our headquarters, and in Charlotte, and really needed a 3rd sales center, and did a pretty expansive review of the country, and really landed in Utah, and has a very favorable business climate, has a very skilled workforce, and of course the geography is quite nice to come and spend time with our associates.
Not that the Loop isn't fantastic, and there's a lot to do in the Loop, but you're probably not going to get any ski runs in within. We'll just say it's a fairly large radius from the center of downtown Chicago to be able to make some good turns. But in any case, let's talk a little bit about your business, and as I alluded to in my introduction, healthcare is something that we're more conscious of because of the Affordable Care Act and that process. But I think a lot of us, and I will say myself included, don't really truly have an understanding of what the health insurance marketplace really even means. When of course, we still have lots of private insurers. We haven't taken away that aspect, but tell us about how it works for you guys in 2018.
Sure. So GoHealth you can think about as a marketplace, similar to the travel industry, where a consumer may go online and start their shopping experience at some place like Orbitz or Travelocity or Kayak. We're that kind of marketplace. So for the insurance carriers, we really give them access to consumers in a very productive and efficient way for them. They focus on what they're really good at, which is healthcare solutions. And more importantly for our consumers, we provide for them some education and some choices. And then one very important distinction with healthcare relative to the travel industry is that we provide a professional licensed agent to help the consumer finish their shopping experience for all the reasons that you alluded to, which is, it can be complex and confusing at times. You have different doctors and networks and pre-existing conditions and medications. Absolutely. And so that shopping experience can be quite complex. And so we finish that shopping experience that many times starts online with a licensed trained professional.
And it occurs to me that when you talk about healthcare, you're talking about the essence, really truly, of each of our own mortality, which introduces to me a huge component of emotion that is completely separate from the process of finding the right product that is best for you, for your situation, for your pre-existing conditions, et cetera.
Yeah. Healthcare it's both emotional in that we all want to feel like we have some level of protection, and then it's also either the first or second largest expense that individuals have. And of course, from a catastrophic perspective, it can far outweigh any other expenditure that we have. So going through the right process to actually get the life insurance, the health insurance that you need, it's really important.
No question. Let's talk about what you have on your plate, because there's some big numbers in your press notes that you need to hire some people. I'm sure you're very busy at it already, but talk a little bit about where you're at in your process. And as you mentioned, Utah's got a great workforce, and you guys are here to provide some great opportunities for Utah workers.
Yeah, so again, we started this process, but growing at 47% a year, we need to continuously add licensed professionals to our workforce. So we started about 2 months ago with the goal of hiring 600 people between July and October 1st. So happy to report we're 400 people into it. Wow. And we have a great workforce, but we're still 200 people in the market. So these are exciting times. Tomorrow we have an open house at our Linden facility where people can bring their families and learn more about GoHealth and the employment opportunities that we have.
I noticed, and this goes back to my days living in Chicago, but I noticed that you had a really important distinction and award that you received, which was the top 101 best businesses to work for in Chicago from Crain's Chicago Business, which is the definitive publication in a very large business community.
Yeah. So, I alluded to the fact that we're 17 years old and we grow at 47% a year.
Yeah, it's tough to get that one around.
And what that really enables us to do is really to offer people a career. So if you think about that kind of growth, you can come into our organization any number of different ways, but because we grow so much, and like our expansion here in Utah, but we really provide vast career experience and opportunities for all of our people.
It's fantastic stuff, and especially in the year 2018, when we've all seen for many years now the statistics on job turnover, and for the individual staying in a position, there's so much value in that, in continued growth opportunities, for stability for families, all of that sort of thing.
Yeah, and part of that recognition that you alluded to with Crain's is, we're much different than just a job. We're a career. We're in an industry that's big and it's growing, and there's a lot of change and dynamics, so it offers a lot of opportunities for professional growth. And then because of our growth, we continuously grow our products and our services. We're technology enabled, so we have some really cool things going on there. And then just the geographic growth as well, that we allow people literally to grow with us.
It's fantastic stuff, Ben. Tell folks, you mentioned the fair that's coming up. Tell folks how else they can get in touch with GoHealth to explore career opportunities.
Yeah, so again, we have a really diverse workforce, but I would say that if you're just starting your career and you're looking for an opportunity to start a career, if you're kind of midway through your career, but you're looking for opportunities for professional and personal growth, or if you're a senior and you just want to be active, you should explore us. You can go online to gohealth.com. We have all the information there. Or again, you can come visit us tomorrow from about 11 till 3 p.m. in our Linden facility.
Fantastic, and I'm sure you've got a great spot down there, being
really
new
nice
to the area. So a lot of great corporate offices down in Utah County. So.
Yeah,
best of wishes for great success. Thanks for coming in, and
so
keep us posted
on
your growth.
Next time you're in Chicago, a steak on me.
All right, that sounds great. Good to see you. Thank you so much.
Thank you so much.
GoHealth, you guys, great career opportunities, a fast-growing company that's right here in Utah now. They are making a commitment, and they are hoping that you may be interested in making a commitment to them as well. We're going to take a quick break. We'll be right back as the show continues on right after this.